Healthcare is complex. It can be an intimidating patient for patients, whether that's pre-visit, during the visit, or post-visit. It can sometimes be scary. This is where Outcome Health really comes in, helping educate your patients at the point of care. Whether that's being in the waiting room, waiting for your provider to call you in, waiting for the provider in the exam room, or even in consultation mode, our devices allow you to engage your patient at every point of care. Our content is specialty specific. So what does that mean? Breaking that down, that means depending on the specialty you're in, you'll see that kind of content. For example, if you're in cardiology, you're more likely to see reminders about exercising, eating healthy, diet and exercise, high blood pressure, and atherosclerosis. If you're in pulmonology, you might see more content around COPD, smoking, and asthma. We partner with third party to help create educational pieces. Some of our partners include Headspace, Healthy Nation, and Verywell. When a patient first walks into the exam room, one of the first things they'll see is the wallboard, which will be in passive mode. So on the wallboard, you'll see a combination of custom content as well as educational pieces, typically public health interventions and specific to your specialty. When COVID-19 happened, our company was able to shift directions very quickly, actually, and create tons of COVID content from the CDC and upload it. Some messages that you saw on waiting room televisions and wallboards included the difference between flu and COVID symptoms, the importance of hand washing, and the importance of social distancing. Having our devices allows you to do custom content, whether you have any of our devices, whether that's the exam room tablet, wallboard, or waiting room television, you can customize that device to make it your own. This can include basically adding anything, flu shot reminders, provider bios, telehealth reminders, basically anything that you'd want to put on a flyer, you can go ahead and put on the device. Think of this almost as an extension of your marketing team. I personally believe that having this can improve patient engagement and really allows you to advertise your initiatives to your patients. From a public health standpoint, I believe that our devices are great from a preventative standpoint and can really help improve healthcare outcomes. A quick study that I wanted to touch on that was actually published in the Journal of Adolescent Health was that having our device in advertising for flu shot reminders increased flu shot vaccinations in clinics about 4%. Some common customizations I often get are flu shot reminders, please silence your cell phone, provider bios, and just vaccine reminders. So obviously the question comes to San, how much does this cost? How do I do this? So the first is this is a free service that a company offers. There's no cost to this at all. There's 3 ways that you can go about doing this. The first is our internal programming team. So some of you might be busy seeing patients and things. The first way you can do it is to just reach out to your CSM and ask for a piece to be created. So, hey, Hassan, I want XYZ piece created. Feel free to drop a line. We have an internal programming team that will create a piece for you free of cost. We'll go ahead, send you a proof, make sure you like it, and we'll go ahead and upload that for you. The second is our member portal where you can access templates and really get to play around and see online and offline devices. You can go ahead and create pieces in there yourself. The third way you can do it, if you have an internal marketing team that has already produced pieces, feel free to drop a line to your CSM and have them upload that piece for you. With COVID-19 comes the concern of our devices and being able to sanitize them. Just like your staff member comes in and wipes down the room, changes the sheet, our devices can be disinfected. So as we see here, switching gears over to the wallboard, we see that the wallboard's in what we call passive mode right now. So on the screen, you'll see a combination of custom content as well as public health initiatives. So here's an example of a piece of custom content, community food bank, COVID-19 piece, and then Dr. Hassan Khan, provider bio. So going into consultation mode at the bottom, I'm going to touch here to start, bringing us into consultation mode. So you have a few different tabs that populate. The first is anatomy, conditions, treatments and procedures, and the whiteboard feature. First feature that I'll touch on is the most used models feature on this device. This is pretty self-explanatory. If you use common anatomy models, those will populate at the bottom. So for this wallboard, you'll see heart, artery blockage, Crohn's disease, and stomach commonly being used. Let's say you're a provider and you don't want your patients knowing what you talk about. That's a clear concern. come right over here, turn that off, and you won't see those models being shown anymore. The next feature I'd like to touch on is the whiteboard feature. This is actually one of my favorite features because it reminds me of a college professor teaching students. So let's say, for example, you're a cardiologist and you're talking about high blood pressure and plaque buildup. Feel free to come here, draw that artery. Say you're talking about blood flow, talking about RBCs coming and showing some buildup. Now I'm going to go back, leave the screen, the current drawing will be lost. A common question that I get is, Hassan, I want to send this home with my patients, can I do that? This is a feature that we currently do not offer. However, a common thing that our providers like to do is just take a picture of it on their iPhone and send it home with their patients. Another concern that often I get is, Hassan, will this be stored? Right here you'll see leave the screen, the current drawing will be lost. For HIPAA compliance, this will not be stored. The moment you hit continue, this is gone and you can no longer retrieve it. Next, I'll go on to anatomy models. So click here, click anatomy, and you'll see a few different specialties populated at the bottom. You see endocrine, digestive, musculoskeletal, neuro. Since we're talking mostly cardiology today, we're going to go ahead and click circulatory. Now we see a few different models populate. Obviously, one of the most important ones, the heart. So let's come over here. As I click the heart, you'll see a 3D model of the heart populate. So here I can really play around with this, move it around, and peel back the layers of this heart too. So let's say you want to talk to your patient about the way the blood's flowing from the left atrium to the left ventricle, you could go ahead and show that to them. Let's say you want to come here and you want to draw something, and you're getting a procedure done here. Feel free to draw that for them. Now I'm going to hit back, leave the screen, the current drawing will be lost, continue, and I'll come back again. And now we'll go on to conditions. So I'm going to go ahead and click conditions. Again, we see the different specialties populate, endocrine, digestive. We're going to go back to circulatory. And the first, we're going to go to advanced atherosclerosis. 3D model will populate. So let's say you're talking to your patient about that plaque buildup again, and you're saying the RBCs aren't getting through. You can really show them what's going on and really move this around for them. So this is kind of like a live model. And again, you can always draw on it. I'm going to go back, leave the screen, the current drawing will be lost, continue. The next model that I'll touch on is the artery blockage. So let's say you have a patient who comes in with high blood pressure, trying to show them what's going on. They're at 70% blockage. Now let's say you prescribe them, hey, diet, exercise, we're going to prescribe a statin, help you out a little bit. Now you're saying, hey, you're at 30% blockage, great job. Same thing, feel free to come here, draw on this wherever you'd like. Leave the screen, current drawing will be lost, continue. I'll come back. The next feature I'd like to talk about is actually the search feature. So it's in the top right corner if you want to search for an anatomy model. So this is a live feature. So let's say I'm looking for the heart again. So H-E-A. So we'll see head, heart failure, heart. Okay. R, and we see heart failure and heart. And you can go ahead and click one, and it'll toggle it up again. Go back. We're back at the main screen. Next feature that I'll touch on is the sleep mode feature. So I often hear feedback from providers assigned, we're having a meeting in exam room 3. We want to kind of put the device to sleep for that hour. In the back of the wallboard, there's a button you can hold. And you'll see a few different options populate. Sleep for 15 minutes, an hour for the day. Let's go ahead and sleep it for an hour. Now we have to wait an entire hour. Just kidding. Tap it and bring it back, and you're back to it.